Did you know so far throughout the DMC we've had over 30 fires? But here at Sinai-Grace we've only had about 5. It's important for all employees to remember their fire response plan, whether you're caught in a real event or if it's just a drill. One thing you want to do is if you're caught in a real event, you're going to want to stop, take a deep breath, count 1, 2, 3, and remember your fire response plan. Failure to remember your fire response plan can delay in getting resources to you. Did you know fire can double in size every 30 to 60 seconds, depending on the fire load? An easy way to remember what to do during a code red incident, we use an easy acronym, which is RACE. You want to rescue, alarm, confine, and extinguish. Rescue. Rescue any patients or employees. First you want to do is feel the doorknob and make sure it's not hot with the back of your hand. If it's too hot, don't go in. If it's cold, you can enter the door and rescue any patients. Alarm. Find the closest pull station, which should be located by all exit points, and pull it. This notifies the fire department and sets the alarm in activation mode. Next, what you want to do is you want to call security using the number 110, which dials directly to security, and report A if it's a false alarm, and B if it's a true fire, and give the exact location. Next step you want to do is confine. If you go into the patient's room to rescue, when you pull the patient out, shut the door. You'll complete the rescue part and the confine part. Extinguish. This is the last step in the RACE steps, which is extinguishment. All fire extinguishers are located by all exit points and throughout the hospital. Know where they are on your units at all times. Once you've gotten to the last step in RACE, the extinguishment, which leads us into our next acronym, PASS. This helps us remember the steps on how to use the fire extinguisher. First step is pull. You're going to want to pull the pin of the fire extinguisher. One key note is don't hold the extinguisher too hard, otherwise the pin won't come out. Next, you want to aim the fire extinguisher nozzle, which is the long black hose. You're going to aim it at the base of the fire. Next, you would squeeze the handle and then sweep at the base of the fire. A couple key points. If the fire is larger than your arm span, wide or high, evacuate patients in immediate danger and leave the fire up to the professionals. If you are the employee who finds the fire, you are currently in charge until security takes over. Know your fire response plan, your RACE and PASS steps. A couple of key fire prevention tips. Always check your floor for clutter in the hallways and stairwells, especially while in front of pull boxes and fire extinguishers. If you are unsure what to do, you can always contact me at 313-966-9395 for any further trainings or education material.